All right, our final speaker for the panel before we move on to hopefully some engaging discussion is Frédérick Pronovost. Frédérick is the co-director of RÉZO in Montreal and responsible for research and development. He's involved in RÉZO as a community worker since 2013, the project manager for the development of MONBUZZ.CA. And in addition to his community involvement, he is both certified in psychosocial intervention from the University of Quebec in Montreal and has a BA in communications from there. Beyond his professional and educational background, Frédérick was particularly interested in new information and communication technology, particularly as it means to intervention with LGBTQ populations. So please join me in welcoming Frédérick.
Hello. Sorry, I'm a bit sick, and it's the first time I'm giving this presentation in English, so I'm sorry. I'm going to search my word for some stuff about MONBUZZ. So today, the objective of my presentation is to show you how we engage the gay man community in the development of our application, MONBUZZ. So I'm just going to put a little context on why on our project before giving you information about that. So as we know, a lot of men who have sex with men substance user remain hidden population in addiction field. It's hard to reach them, and mostly when they reach our services, it takes longer to them to reach us. So their problematic is mostly harder. I don't know how to say. Sorry. And yeah, so with that, we've decided to do an online intervention to try to reach those hidden population, and so we've developed MONBUZZ.CA. MONBUZZ.CA is a web-based brief intervention based on the SBIRD principle. So SBIRD is screening, brief intervention, and referral to treatment. So this was our model to develop this platform. So the objective of MONBUZZ at first was to inform them about the risk and harm associated with substance use, especially on their sexual health, to reduce harm associated with substance use, and to refer them to appropriate services. So, first of all, for the development of MONBUZZ, we really wanted to have a platform where it's close to the reality of our communities. So at first, we really want them to be engaged in all the development of the platform, the content, how we write stuff, how's the interventions going to be on the website, and so it was really an intention for us to have them implicated in the development. So the aim for I don't know if I've said it, MONBUZZ was also a research project. At RÉZO, it's a platform we will use for the next years, but it was a partnership with Sherbrooke University. So at first, the research project was to document the collaboration process between the stakeholders around the development of this internet-based intervention, to document the implementation and the acceptabilities of our platform, and to assess the feasibility to conduct any web-based impact research of different intervention components on substance use and sexual health. So I'm gonna pass that. So to involve our communities in the development of MONBUZZ, at first we've done 3 committees, the management committees where RÉZO and the University of Sherbrooke was involved. After that, we had the development committee. So for maybe about the 6 or 7 months of development of our platform, many community services, public and private health services, public health, and trans men, gay men, substance user, gay men were in that committee and were giving us information about how we should present things on our website. And yeah. So at first we've done a focus group and consultation with the potential user. The project at first was calling Ego Portrait, which is selfies in English. It was referring about on the process, the screening and brief intervention, but we knew that it wasn't something that our communities would rely or get touched by it. So we've done a focus group, and what comes from it is MONBUZZ name. So it's an empowering name, I found, because our objective with the platform was to give them something where they can find information but not judging them. It's really a platform where they can empower themselves, have control on their substance use, and go wherever they want to go. So MONBUZZ is like my buzz in English. So it's their substance use. They do what they want with it. And yeah, we've spoken about the visual identities, how they what they want or they don't want. So what they told us is that they don't want nothing explicitly related to substance use, sexualities, or MSN to avoid identification. They wanted to have a nuanced view about substance use. So yeah, the risk, but also like I don't know. Like say yes, it's cool, you have fun with your substance use. Also reflect the positive reality about their substance use, and they didn't want something that looks like a government website or a health website, and even they didn't want us to put all the names of the partner that are related to those government websites. So, and for the content, what they want was an approach non-judgmental about harm reduction, recognize both pleasure and risk. The choice of wording, they want a common language, accessible and respectful of the LGBTQ subculture. So to have a wording where bisexual guy, trans guy would be also related to our wording. Of course, the duration was a issue there. So what they want was a brief but accurate and scientifically sound, which acknowledged the different dimension of sexuality. Yeah, I didn't told you that at first, but we didn't want something focused on only substance use, but we wanted to acknowledge the sexual component on the substance use of our community. So at first we have something to assess their consumption, and we produce a survey about the influence of the substance use on their sexuality and vice versa. Is it snoring? When I snore, it reminds me the guy who's present now. I'm sorry, I'm not like him. So yeah, so we took all those information and we start to work on our website. And with the firm, we are in affair too. I don't think it's the good word, but whatever. They've decided to approach us with something not common for questionnaires and survey. They wanted to have something more conversational, so more like Google Allo now. So instead of only have like a question and mark those answers, it's the MONBUZZ bot who will ask you the question and you can answer like if it's a conversation. And you know, some of the question on MONBUZZ is also like it gives the opportunity to the person to think about their substance use. So in this way of presenting our survey and stuff, I think it's more human and than only have a website with a normal website. The challenge, and so what we want is really reach a population that we don't see. So there is some challenge on the promotion and promotion strategies. So normally, most of the community organization only launch their thing and go on like common magazine on our stuff. So we really want to have a broader approach. So we will engage in banner ad, website, Scruff, every application where those guys meet. And yeah. So the issues about this website was to keep balance between the gay communities and the scientific team and the IT firm. We all have needs, and it's not always easy to try to find a way to go together. The IT firms, it's not. They want something that is not that doesn't cost a lot. We want something that do our dream, and sometimes it doesn't exist in the technology. So it's always it's always hard, and we have to keep balance between that. So yeah. I'm sorry if my presentation is a bit messy, but I just want to be sure if you understand what the MONBUZZ website is going to be. So at first, the person is going to go on the website and answer to some question about their substance use, the motivational aspect, if they are already or not, and about the sexuality and consumption, the substance use impact. And they will receive a feedback on that, on their substance use. It's very motivational stuff. It's going to be personalized on his substance use and the sexuality he have. And he will have many options of what to do after that. And if the person wants, he will be able to reach a community worker directly on the website, and he can even take an appointment if he wants to come back later. So it's about what the website's going to be. And it's the first phase. We have many ideas to how improve the website. I've thought some things like where the person can, because we know most of the community person who use substance mix them. So I want in the next phase to have a platform where they can mix all their drugs and see what the results are, what the risks are, and take a decision on those information. And we also want to go in a way of having automatic intervention. At first, that was our big ideas, but the budget was a bit too low for those stuff. So it's the first phase of the project, and we will improve the platform from year to year. It's going to be in French first, but we plan to have it in English after, and even in Spanish, to reach most people of our community. So I think it's about that I want to say for MONBUZZ.
Merci, Frédérick. So we now have about 14 minutes or so to have a discussion about the online and mobile tech environments and how it relates to gay men's health and stigma. So there's 2 mics. We'll alternate back and forth. Let's go start with Mo. Thank you.
Hi, I'm Mohammed. Great panel. I'm a research assistant at UBC with the youth sexual health team. I have 2 main questions. The quicker one is from Troy, and it's about the data you presented about the positive cases. And I noticed that there was no HIV positive case, and I was wondering if that translates to anything. Are we missing the HIV? Well, like maybe the more hard to reach populations that could be infected with HIV. And my other question about the online interventions goes to Dan and maybe the whole panel. And it's been something I've been thinking about in the past few months about all the existing online interventions that focus on increasing knowledge are very exciting and they're very much needed. I was wondering how we could assess their effectiveness and their impact as an intervention. Are you doing something to see whether this knowledge transfer is leading to a behavior change? And if yes, like how are you designing the studies to be able to capture whether this is leading to any sort of behavior change in the long run? Thank you.
Yeah, the first question is definitely easier, and I can answer that. I don't know if I don't have a complete answer for you, but so I think you ask a very good question, and the part of the answer is maybe we don't know. Maybe there is something about the fact that there have been no positive HIV results so far that indicates that the program maybe isn't reaching some people. Maybe the other, I guess, the easier answer, or the sort of more common sense answer, would be just looking at absolute numbers of cases per year in the province of each of the STIs. You know, in terms of absolute numbers, HIV is around 250 per year in the province. Syphilis is about 670. Gonorrhea and chlamydia are like well above that. So you would expect just on the looking at those numbers that it's not outside the realm of possibility that we may just not have picked up a case yet. But you do ask a good question. I don't know if there's, I don't know if there's, there are definitely probably people who are missing, but I don't know. We haven't been able to determine that.
Okay, so we actually do have an evaluation process that will start just for the record too, I guess I didn't really mention this, is that the site hasn't officially launched yet, but will probably launch within the next few weeks. So that being said, we have an evaluation committee that's set up, and there'll be a sort of like 4 major themes that they'll be looking at. So like the first three themes really center around user experience. So like when they go to the site, there'll be prompts, simple prompts, like did you find what you were looking for, yes or no? And then we have a breakdown of analytics that will talk about the most frequently used pages in the site. Did they watch the videos? There are a few things that, for example, we have a PEP and prep sort of script that you can bring to your doctor to have a conversation to sort of guide the conversation about access. So we can sort of track how many times that's been downloaded, as well as like a breakdown of regions. So again, like I work with a network of people, so they want a sense of where people are accessing the site from. So we have people living in sort of the metropolitan areas around Toronto and Ottawa, but also northern communities. So they just want to be, we want a sense of like how many people in Thunder Bay are going to be accessing the site. So people in those regions will have a sense of usership there. And then there's also a theme around sort of evaluation of how we've engaged the people that we're working with. So the frontline workers who have been there to inform the site will be evaluating our work and being able to engage them and get them involved. And do they feel like they were heard? Do they feel like the information that we were working with them is presented accurately, and how effective they've been able to use it in the work that they're doing? Does that give you a sense of that? We can talk about it more afterwards if that's easier.
Great. Other questions? Okay, well, I have one, since there aren't any others. But I'm interested in anyone's comment on differences between the conventional internet platform and mobile technology, and if there are ways in that could be playing out better in delivering women's health services. We talk about websites as sort of like conventional internet media, but people are less frequently visiting websites and are rather accessing web content in an app or in social media, and just your general thoughts on that.
I can speak to a little bit of that, specifically relating to Get Checked Online. You may recall when I was going through the procedure of how one accesses an account, one of the necessary steps is to print off, like who prints anymore, but is to print off a requisition. And at this point, there's no real way around that. But it's been identified, just sort of answering one of your original questions about evaluating and ongoing evaluation of programs. That's one thing that's been clearly identified as a barrier, so printing. So, because not everyone has printers. Even at the HIM clinic in Vancouver, there's been, I think it's still there. There was a computer set aside specifically for that purpose, and people who were turned away or weren't able to be seen at the clinic, there was a computer and a printer there so that they could print off a requisition for Get Checked Online in case they didn't have a printer at home. Without a printer, it would require something on your phone, like a barcode that could get scanned at the life. Just that technology, we're working towards that, but at this point, it's definitely a barrier that's been identified, and we recognize it as a barrier. But in the interim, we just need to kind of keep going with what we're doing. But that's, I think, a very clear example of how this is probably a much more practical way to do things than that thing over there, right? So that's just one concrete example from our program.
And Kiffer, in your work, can you differentiate from your data extraction whether people viewed these things on a mobile device or on a computer?
Not in the analysis presented here, though I think it raises an important point because elsewhere in the literature, for example, with regards to sex-seeking apps, which you and I both research with momentum data, we know in the literature that the difference between apps and websites is clear in terms of the demographics that access those technologies. But it's also possible to believe that people might engage within person. So within person comparison, it's possible to believe that somebody might engage differently with the apps that they use. Because I know me, myself, and I'm sure many of you who have smartphones, I engage much more with my smartphone via content than I do my computer. And I use these two different technologies for quite different purposes. And my behavior is different on them. And so I think not only is there this documented potential that there's this demographic difference of the audience in those sites versus apps, but there's also a potential for within-person differences as well.
Good point, thank you. We have time for one more comment if there's any last burning question. Seeing none, we will break for lunch. So thank you all to the presenters again very much. Thank you all to everyone for joining. Enjoy the rest of the summit.